1. The Subcommittee on Oversight, Management, and Accountability will come to order. Let me begin by thanking all of my colleagues for joining us today for the first fully remote proceeding for the Committee on Homeland Security. The COVID-19 pandemic has interrupted all of our daily lives and the ability of the House to safely conduct its business. And I want to thank my colleagues for coming together, despite differences and reservations regarding continuing our business in a remote setting, to move forward in a productive, bipartisan manner for the benefit of our constituents and our country. I look forward to the day when we can all safely meet together in person, and I'm so grateful to have all of you as colleagues. With that, I turn to the topic of today's hearing, the Department of Homeland Security's DHS plans to resume operations in the wake of the coronavirus pandemic. First, I want to acknowledge that many of DHS's employees never stopped working during the pandemic. They faced unprecedented challenges, and I thank them for continuing to carry out their important missions during these challenging times. That said, the pandemic has required the department to significantly adjust its operations in ways it never had to before. Employees that could work remotely shifted to telework. Procedures for those that couldn't were altered or suspended altogether. For example, the Federal Law Enforcement Training Centers, FLETC, which trains law enforcement officers across DHS and other federal agencies, halted all in-person trainings for 12 weeks. DHS also closed immigration service centers and enrolled centers for trusted traveler programs, such as the Transportation Security Administration's PreCheck and Customs and Border Protection's Global Entry. As DHS resumes these operations, it is important that the department have plans in place to adequately protect the workforce's health and safety, such as regularly cleaning facilities, adjusting workspaces to align with social distancing guidelines, and providing personal protective equipment. Since infection rates have begun to rise in some areas of the country, comprehensive testing, especially for frontline operators, and contract tracing is also necessary to minimizing exposure. Given the department's mission, most DHS employees have continued to work on the front lines, answering the call to protect our nation from a variety of threats. But the recent pandemic has required considerable and unparalleled sacrifices from these dedicated public servants. Many have been working around the clock to coordinate assistance and response efforts, and frontline operators face an even greater than normal risk of exposure to this deadly virus. All the while, workers are juggling concerns about the well-being of their loved ones and family commitments, with most schools and daycares closed. I worry about what toll this will have on employee retention and already low morale, an issue this subcommittee has explored during a hearing earlier this year. The department itself is not immune to the virus. To date, DHS has experienced over 1,600 COVID-19 cases, including 10 deaths among its workforce. My condolences go out to the families and friends of those employees that have succumbed to the disease. Now more than ever, it is important that DHS ensure its workforce feels safe and supported as it carries out its vital mission to protect the homeland. To that end, I support providing hazard pay to frontline workers who faced increased exposure to the virus while on duty. I look forward to hearing from our witnesses today on their views of DHS's effort to protect the workforce and any recommendations for how we in Congress can support the department as it resumes operations. Thank you again for joining us today. The chair now recognizes the ranking member of the subcommittee, the gentleman from Texas, Mr. Crenshaw, for an opening statement.
Thank you, Chairwoman Torres Small. I want to start my statement by remembering and commemorating the life and service of Border Patrol Agent Johann Morden. Agent Morden's watch ended last Thursday, June 11th in New Mexico. Agent Morden volunteered to serve and protect our nation's border. While most of America was shut down and many in government worked from home, Agent Morden continued to be on the front lines with the many men and women of the DHS whose mission does not allow them to work from home. We are forever grateful to these men and women. I'm grateful we can have this hearing today about the important topic of getting all of DHS back to work for the American people. DHS has over 200,000 employees tasked with protecting the American homeland. Although COVID-19 is a significant threat to the American people, the threat of terrorists, criminals, and others who wish us harm does not diminish simply because our focus may be elsewhere. And because terrorism does not take sick leave, It is essential DHS leadership maintains operational capabilities throughout this pandemic while striving to keep its employees healthy. Although many DHS employees perform duties that do not allow them to telework, for those that are able to telework, DHS quickly initiated telework policies to protect those employees. As part of the reopening of America, the Office of Management and Budget and the Office of Personnel Management issued guidelines based on information from the CDC for the heads of all federal agencies to utilize in making decisions regarding returning employees to on-site work. Those guidelines allowed agency heads to exercise a great deal of discretion. It is my understanding that DHS has been developing plans for return to work that include a lot of flexibility for its workforce and take into account underlying conditions as well as specific circumstances of employees. As DHS begins to transition back to normal operations around the country, the health and safety of the employees returning to on site work is of the utmost importance. Given that many DHS employees continue to work at their duty stations, the department should focus its plans on keeping all DHS employees, whether in the office or in the field, safe and healthy as we continue to battle COVID-19. As we move toward reopening facilities, it is important to realize that the health and safety of employees is intertwined with the health and safety of the American public that they serve. The employees at DHS must be protected from individuals with COVID, but also need to protect individuals visiting DHS facilities from being exposed to COVID. This will require proper screening tools for anyone entering the facilities or work sites, and adequate protective gear and barriers for both employees and the individuals they serve. Some DHS employees, such as those at USCIS, which operates on a fee-based model, are facing the real possibility of losing their jobs and income due to agency activities having been put on hold during the pandemic. And although it's important to keep people healthy by preventing exposure to COVID, we should keep in mind that health is also tied to having enough money to meet basic needs. The loss of jobs and businesses from the widespread closures is a real public health threat that must also be addressed. Unemployment can lead to both physical and mental health issues. There's plenty of evidence for that already. We must get creative in addressing this shortfall as well. DHS needs to have a plan in place for addressing the needs of employees as well as the public. The plan must have sufficient flexibility built in to allow for modifications as information on containing the virus continues to evolve. I look forward to hearing from our witnesses today on the needs of the employees they represent and the steps DHS should take to protect them. While I'm pleased to participate in this important hearing today, I would prefer we conduct OMA hearings in person, and I want to be on the record saying that. There's no reason our small subcommittee cannot safely meet in our committee room, and I hope that's what we do next time. And I hope this is the last time we have this virtual hearing, and look forward to working together to make that a reality. I yield back.
Thank you, Ranking Member Crenshaw. With that, I will yield to the Ranking Member for the purpose of a colloquy.
Yes, the colloquy. Thank you, Madam Chairwoman. Could you please explain our agreement on committee procedures during these remote proceedings?
I thank the Ranking Member. Let me begin by saying that standing House and committee rules and practice will continue to apply during remote proceedings. Members will be expected to continue to adhere to the rules of the committee and the House. During the covered period as designated by the Speaker, the committee will operate in accordance with House Resolution 965 and the subsequent guidance from the Rules Committee in a manner that respects the rights of all members to participate. The technology we are utilizing today requires us to make some small modifications to ensure that the members can fully participate in these proceedings.
Thank you, Madam Chairwoman. Could you elaborate on your plans for rehearsal sessions before remote proceedings?
Thank you. Given these new circumstances, the committee plans to hold rehearsals before our first remote hearings and markups in the full committee or in a subcommittee in furtherance of House rules and regulations. These rehearsals should help iron out technical issues and ensure that members remain connected if they must change devices or locations.
Thank you, Madam Chairwoman. Could you elaborate on how members may expect to be recognized during a remote proceeding?
Thank you. First, to simplify in order of questioning, I will recognize members for their 5-minute questioning based strictly on seniority basis as determined by our committee roster, a departure from our previous procedure. Members must be visible to the chair in order to be considered as present for the purposes of establishing a quorum or for voting. Members should also make every effort to remain visible on the screen throughout the proceeding. If a member experiences issues with their video stream, they may proceed with solely audio to ensure a connection, provided they have been identified previously. At the beginning of this hearing, members are on mute. Members may unmute themselves in order to be recognized for purposes of their 5-minute questioning of witnesses. At the conclusion of speaking, members will be expected to then mute themselves to prevent excess background noise. If a member does not mute themselves after speaking, the clerk has been directed to mute members to avoid inadvertent background noise. Should a member wish to be recognized to make a motion, they must unmute themselves and seek recognition at the appropriate time.
Thank you, Madam Chairwoman. What could a member expect should they encounter technical issues during a remote event?
In the event a member encounters technical issues that prevent them from being recognized for their questioning, I will move to the next available member of the same party, and I will recognize that member at the appropriate time slot, provided they have returned to the proceeding. Should a member's time be interrupted by technical issues, I will recognize that member at the next appropriate spot for their remainder of time once their issues have been resolved. If I should encounter technical issues myself, the vice chair of the committee, if available, or the next most senior member of the majority shall assume the duties of the chair until I am able to return to the proceeding.
Thank you, Madam Chairwoman. What should members expect regarding a decorum during a remote event?
Thank you. Members are reminded that they are only allowed to attend one virtual event at a time. Should they need to attend another committee's proceedings, please fully exit the hearing before entering another proceeding. Finally, all members are reminded that they are expected to observe standing rules of the committee decorum for appropriate attire and should have a professional and apolitical background when they are participating in any remote event.
Thank you, Madam Chairwoman. What should members expect if a witness loses connectivity?
Thank you. In the event a witness loses connectivity during testimony or questioning, I will preserve their time as staff address the technical issue. I may need to recess the proceedings to provide time for the witness to reconnect.
Thank you, Madam Chairwoman. Finally, what should members expect if a vote is called during a remote event?
Thank you. House Resolution 965 requires members to be visible present to have their vote recorded during a remote event. Members who join the proceeding after a vote is called and who are not called upon for their vote should seek recognition from the chair to ensure their vote is recorded. Should a member lose connectivity during a roll call vote, I will hold the vote open for a period of time to address the technical issue and provide members with an opportunity to have their vote recorded.
Thank you. I yield back.
With that, I ask unanimous consent to waive Committee Rule 8A2 during committee remote proceedings under the covered period designated by the Speaker under House Resolution 965. Without objection, so ordered. The chair now recognizes the chairman of the full committee, the gentleman from Mississippi, Mr. Thompson, for an opening statement.
Thank you, Chairwoman Torres Small and Ranking Member Crenshaw, for holding this hearing today. It is fitting we're here to discuss the Department of Homeland Security's efforts to resume operation. The fact that we're holding this hearing remotely demonstrates that we have all had to adapt to operate because of coronavirus pandemic. Many of our nation's communities are still experiencing increased rates of COVID-19 infections and death. Even in areas where rates have improved, public health officials warn of future outbreaks if people do not continue smart practices. These include social distancing, wearing a mask or facial covering, and frequent hand washing. Yet the president refuses to do these things. Time and time again, we see him fail to take advice of medical professionals seriously. I fear that in his haste to reopen America ahead of doctors' advice, President Trump will try to force federal workers back to their offices in an attempt to convince Americans it is safe to return to business as usual. But it's not safe. Pushing federal workers to resume operations without taking measured precaution needlessly puts them at risk. This is especially true of DHS, whose workforce is already in harm's way, with 85% working on the front lines. Tragically, two of DHS's component agencies have some of the highest infection and death rates among federal government agencies. The Transportation Security Administration has announced that 667 employees have tested positive and 5 have died from COVID-19 on this website. Customs and Border Protection has publicly posted that 482 of its employees have tested positive and 5 have died. Therefore, it's critical that DHS have a plan in place to protect the health of its employees before reopening facilities or resuming operation. That plan should allow employees who've proven that they can do their jobs from home to continue to work from home. This is especially important in metropolitan areas such as Washington, D.C. and New York City, where many workers rely on public transportation. If employees cannot work at home, DHS must take every precaution to keep them safe. That is why I supported TSA's request for supplemental appropriations for personal protective equipment, which was included in CARES Act. I also joined several of my colleagues on this subcommittee to co-sponsor H.R. 6655, the Hazardous Duty Pay for Frontline Federal Workers Act. This bill will create a separate pay category to compensate frontline workers, including TSA employees, for their increased risk of exposure to COVID-19 while on duty. I welcome and appreciate our witnesses for joining us today. I look forward to hearing their thoughts on how we can best support the department's workforce during these challenging times. And I urge the administration to ensure all federal agencies protect the health of America's public servant. And I yield back, Madam Chair.
I now welcome our panel of witnesses and thank them for joining us today. Our first witness is Dr. Everett Kelly, National President of the American Federation of Government Employees, which is the largest union representing federal employees nationwide. AFG represents nearly 100,000 employees across DHS headquarters and several of its components, including the Transportation Security Administration, Customs and Border Protection, U.S. Citizenship and Immigration Services, and U.S. Coast Guard. I apologize that unfortunately we have lost the AFG witness and he is trying to reconnect. And so I think we may, let's see, we're trying to reconnect now. I'll continue reading his bio, and if we're unable to get him by that point, we will take on this first challenge of a remote hearing. I think we're going to go ahead and move to our second witness from NTEU. Okay, but I'll read the I'll read Dr. Kelly's bio as well. Dr. Kelly has been a member of AFG since 1981 and became national president in February 2020. Our second witness, Mr. Tony Reardon, serves as the national president of the National Treasury Employees Union. NTEU represents 150,000 federal employees, including personnel at Customs and Border Protection and the Federal Law Enforcement Training Centers, or FLETC. Mr. Reardon has been with NTEU for 30 years and was elected national president in August 2015. Our final witness, Mr. Braden Judd, serves as the president of the National Border Patrol Council, which represents more than 16,500 Border Patrol agents. Mr. Judd is a Border Patrol agent with over 20 years of experience and is currently assigned in Montana. Without objection, the witness's full statements will be inserted into the record. I now ask each witness to summarize his statements for 5 minutes, and we were going to begin with Mr. Reardon. Please proceed.
Chairwoman Torres Small and Ranking Member Crenshaw, thank you very much for the opportunity to testify on behalf of over 27,000 frontline Customs Border Protection officers, agriculture specialists, and trade enforcement specialists at CBP. These men and women are stationed at 328 air, sea, and land ports of entry and at pre-clearance operations overseas. They ensure the efficient processing of legitimate trade, travel, and asylum seekers who present themselves at the ports, and stop illicit trafficking of people, drugs, weapons, and money. Throughout the pandemic, most ports of entry remained open and staffed by CBP Office of Field Operations, or OFO employees, 24 hours a day, 7 days a week, at great risk to their health and safety. The CBP workforce as of June 9 has more than 459 confirmed COVID-19 cases, according to CBP-wide figures, and many more employees in quarantine. Of these employees, 5 who have worked for OFO at the international ports of entry have died after contracting COVID-19. So I want to honor these NTEU members by name. CBP technician Van Dong worked in agriculture secondary at Los Angeles International Airport. CBP officer Richard McCoy worked at the Fort Lauderdale Port Everglades Port of Entry in Florida. CBP officer Omar Palmer, CBP officer C.K. Yan, and field technology officer James Taylor, who all worked at John F. Kennedy International Airport. NTEU mourns the losses with the family and friends of these officers and appreciates their service to our country. In my written testimony, I have listed workplace safeguards that, absent the development of a successful vaccine, are needed at the international ports of entry. These safeguards include free on-site testing, contact tracing, increased work area cleanings, plexiglass barriers, sufficient PPE, and social distancing protocols. In addition to ensuring workplace safeguards, one of the most critical pandemic-related issues facing CBP employees at the ports of entry is the reduction in user fees collected due to the drastic drop in international commercial travel, and to a lesser extent, trade volume since March 2020. These user fees fund 40% of CBP OFO's budget, including 8,000 CBP officer positions. That is roughly 1/3 of the entire CBP workforce at the ports of entry. Without supplemental appropriated funding to support these CBP officers between now and the end of FY 2020, we are gravely concerned that this loss of user fee funding will result in furloughs at a time when this workforce is most needed to facilitate the flow of legitimate travel and trade as the economy recovers. Recently, NTEU and 15 leading port leaders asked House and Senate appropriators to provide funding in either a DHS supplemental funding bill or in the next COVID recovery package to make up for user fees lost because of the pandemic and to help CBP respond effectively to the COVID-19 related challenges it must overcome now and in the future. It is our understanding that new trade and travel volume data collected by CBP shows a user fee funding shortfall of over $400 million in FY 2020 and a need for over $1.5 billion through FY 2021 to cover the user fee shortfall through the next fiscal year. This supplemental funding would help to ensure that current CBP officer staffing levels are maintained and that CBP does not lose the hiring and staffing advances that they finally started to gain after years of effort and much appreciated funding support by Congress as trade and traffic volumes increase. So NTEU implores you to support additional funding now so that CBP officers can stay on the job during the economic recovery. CBP employees at the ports of entry already face many challenges in the course of their work and concerns about their health and safety, or of being furloughed as the country reopens for business, should not be among them. Thank you very much, and I'm happy to answer any questions that you may have.
Thank you for your testimony. I now recognize Dr. Kelly to summarize his statement for 5 minutes.
Okay, thank you so much, Chairwoman Torres Small, Chairman Thompson, Ranking Member Crenshaw, and members of the subcommittee. My name is Everett Kelly, and I am the National President of American Federation of Government Employees. Thank you for the opportunity to testify today. However, I first of all want to recognize Border Patrol Agent Morton, who lost his life recently in the line of duty, and would like the privilege of taking 10 seconds of my allotted time just to think about him for a moment. And I'm prayer. Thank you so much. Just want to remember him and pray for his family. For those on the front line, the decision to reopen should be about preventing additional dangers to the health and safety of this vital workforce. These are people who show up and do their jobs when their lives are on the line, when the safety of their families is not ensured, even when they don't take practical steps to protect them. We have learned a lot about what it takes to beat the pandemic and provide protection until there is an effective vaccine or treatment, social distancing, widespread testing, contract tracing, and rapid response to new outbreaks. Without these, we know we'll experience repeated resurgence where thousands more will suffer and die. Every effort should be made to avoid this outcome, not only at DHS, but throughout the United States and the world. Resuming operations safely must be considered broadly, both in terms of what is safe for the public we serve and what is safe for the DHS employee and workforce. If reopening occurs when new cases and death rates are still increasing, we risk further infection among the brave men and women who are working to keep our country safe. On April the 20th, OMB released its only guidelines or guidance on reopening. The guidance was to plan for a three-phase reopening based first on 14 days of declining case of COVID-19, inadequate testing, and hospital capacity. It didn't call for provisions or personal protective equipment, but did indicate that agencies should not move from one phase to the next until workspaces were equipped with protective measures such as higher dividers and more frequent cleaning. The guidance indicated that in the first phase, employees with vulnerable health conditions were to be provided telework or weather or safety leave. FG responded to OMB by setting forth 6 preconditions for reopening that we believe should be met, emphasizing that the administration's effort to promote reopening were premature and unwise. The preconditions outlined were universal testing, use of science-based standards for a safe return to work, equal treatment of the workforce in implementing preventive measures, making our workplace safe, including the provision of personal protective equipment, sending home systematic employees, and working with unions to battle this pandemic. To this last point, DHS employees on the front line and those who are teleworking are safer when the department demonstrates a willingness to engage with the workforce and their unions in order to gain their views, hear their concerns, and entertain their suggestions on how best to proceed in the context of the risk created by the pandemic. And time doesn't allow me, permit me to go into details about the experience our members have faced during this pandemic, but what I will tell you is FEMA employees still need FDA-approved PPE as hurricane season has started. Both passengers and TSOs must be required to wear masks, and TSOs need FDA-approved surgical masks to be provided by TSA. CIS employees need to stay on the job. They shouldn't rather be furloughed or RIF'd. Law enforcement officers need full retirement benefit if they become disabled, and their families need support as survivors if they lose their lives during the COVID-19. And all of the frontline DHS workforce need premium pay and automatic presumption of workplace illnesses and the stringent application of workplace safety standards. Let me emphasize my point about CIS. This crisis looms immediately before us. And I urge this committee to work with leadership and appropriations members to make sure that this threat of RIF and furloughs does not happen, and CIS has provided funding in the next COVID legislation passed by Congress. Although CIS is characterizing their layoff as furloughs, they are processing their layoff actions in accordance with RIF procedures. Such procedures require that RIF notice to be issued to employees if the furlough may last more than 30 calendar days. By using RIF notices rather than furlough notices, CIS can extend the layoffs up to 1 year. The bottom line is that CIS is placing employees in the status of being furloughed and potentially RIF'd at the same time. As such action to prevent these CIS furloughs or RIFs is extremely urgent, and I ask you to act on those, and I thank you for the time that you've given me today. Thank you so very much.
Thank you for your testimony. And as I recognize Mr. Judd to summarize his statement for 5 minutes, please allow me to add to the condolences and extend my own very personal ones because of the work that Agent Morden did in my district and the hard work that is called upon for Border Patrol agents. Thank you for your presence here today. Thank you for your representation of them, and my deepest condolences to the family as well, and gratitude for the work.
I'd like to start by thanking both Congressman Crenshaw and Congresswoman Torres Small for extending that heartfelt condolences to the family of Agent Morden. This was a great individual who was working to protect his country when he passed away. Unfortunately, we've buried way too many Border Patrol agents who have been out trying to do the best that they can to protect this nation. I want to thank you for having this hearing, both Congresswoman Torres Small and Congressman Crenshaw. And as you already said, the MBPC represents 14,500 rank and file agents of the Border Patrol. And on behalf of these men and women, I would like to thank you for having this hearing. During this time of great civil unrest, I would be remiss, because I am a uniformed law enforcement officer, I would be remiss if I did not recognize the situation surrounding George Floyd. I was thoroughly disgusted to see video of Officer Chauvin with his knee on George Floyd's neck. I was even more disgusted when I watched as Officer Chauvin failed to show the slightest modicum of human decency as Mr. Floyd begged for his life. I was mortified that a person who was supposed to be the good guy was worse than the criminals law enforcement officers come in contact with on a daily basis. Officer Chauvin's actions can never be repeated, but just as important, the men and women in law enforcement must understand and believe that we are not above the law, and we all must believe that racism has no place in society, especially in law enforcement. With that being said, it would be absolutely unfair to paint a picture of all law enforcement simply because of what one man did. That individual must be held accountable. All law enforcement also must look at this, learn, and try to do better. I'd like to address the topic of this hearing. Border security has gone completely uninterrupted during this pandemic, and I want to thank DHS for doing all that they can to make that happen. And while the men and women of the Border Patrol are no strangers to dealing with extraordinary circumstances, including communicable diseases, in their everyday jobs, the COVID-19 pandemic has created unique challenges. And I am proud to say Border Patrol agents across the country have risen to the occasion to protect our borders, even in the face of unprecedented circumstances. But we could not do it alone. After nearly 23 years in the Border Patrol, I can emphatically say that without the support of this administration, we would not succeed. And President Trump's quick action to initiate Title 42 authorities has driven illegal immigration numbers to the lowest levels in my career. This has allowed us to detect and apprehend the vast majority of those that have entered our country illegally over the past few months, and it has undoubtedly prevented additional cases of COVID-19 from coming to U.S. communities. As you are undoubtedly aware, and as I previously stated, since the onset of COVID-19 pandemic, the Border Patrol has generally fared well along the southwest border from a border security perspective. Additionally, from a health and safety perspective, we have also generally fared well and have been incredibly fortunate that the number of COVID-19 cases among agents has thus far been low. The men and women of the Border Patrol have been able to continue border security missions while also protecting our agents with little to no disruptions. With the Border Patrol as an example, I believe the federal government can operate at high levels while also managing the spread of COVID-19. As a microcosm, I think that we can look at the Border Patrol and we can say, because of all of the different ways that we patrol the border, we're also in office settings, we're in the field, we deal with individuals that come in the most dire of circumstances. They are held in stash houses, in locations that have diseases that run rampant. Yet, because of the actions that have been taken, the simple little actions that do not cost money, the Border Patrol has been able to continue to operate. And I believe that in office settings, the federal government can also continue to operate and exceed the levels of service that the U.S. citizens require and expect of the federal government. There are certain concerns that we have that we need to address. The need for additional space is going to be critical, even if Border Patrol continues to expel illegal immigrants under Title 42. The size of a potential surge the country of origin of illegal immigrants, the willingness of countries to take their own citizens, and the health status of the individuals we apprehend are all factors that are going to drive the need for more capacity. Catch and release in a pandemic is simply not an option. We have had good success processing detainees in the field. This is one of the reasons I believe we have kept our COVID-19 infections low. By processing in the field, we are not exposing an entire Border Patrol station to a potential infected individual. One limiting factor is internet connection. Without proper connection, we cannot conduct criminal background checks and enter biometric data on the detainees. As you know, internet connectivity is spotty at best along the border. However, there is military technology available that could give us this connection, and it's my understanding that it can be done at minimal cost. Border Patrol currently does not have any testing capacity for agents. Instead, we must rely on local medical facilities, which in border communities are already overstretched. Given that COVID-19 will remain a threat until a vaccine is developed, Border Patrol leadership needs to either develop this capacity in-house or contract out the function. The most effective method available.
Mr. Judd, I apologize. Your time is expired. If you wouldn't mind just wrapping up.
Absolutely. There are many things that can be done in the federal government that don't cost the taxpayer money that will allow us to continue to operate as the federal government. I appreciate your time and look forward to answering any of your questions.
Thank you very much, Agent Judd. I thank all of the witnesses for their testimony, and I will remind each member that he or she will have 5 minutes to question the panel. I will now recognize myself for questions. I understand that DHS headquarters developed guidance for resuming operations, but it is allowing individual components to take the lead on when and how they reopen facilities and resume functions that were paused or modified due to the coronavirus pandemic. As we've noted just recently, we're on limited time here. So I'd ask each witness, starting with Mr. Judd, to just very briefly describe the level of engagement your representatives have had with individual DHS components on their plans for reopening, just how you've engaged.
We've had a high level of engagement. I continue to communicate with Commissioner Morgan as well as Chief Scott on a regular basis as far as what needs to be done. Chief Scott has done a very good job of allowing his sector management to determine what needs to be done to reopen facilities fully. Again, I appreciate the level of commitment that he's shown to making this happen.
Thank you, Mr. Judd. Dr. Kelly, your extent of engagement with representatives? Oh, and I apologize if you can go off mute. Oh. There you go.
Thank you so very much. Okay, let me say first of all, you know, unlike Council President Judd, we have had, you know, any number of attempts to try to get the various agencies to communicate with us and work with us. You know, however, we've been unsuccessful. For most of DHS, you know, we've just not been able to get them to allow us to come to the table and share, you know, in the responsibility. I'm going to call it responsibility because I think that's what we all have, you know, getting our workforce back to work safely. You know, I would leave it with that. But
thank you, Dr. Kelly. And Mr. Reardon?
Yes, thank you for the opportunity to answer this question. We've had actually a pretty high level of discussion with CBP. We've talked to DHS on a weekly basis. We've dealt with Angie Bailey, the HCO. Every week we've had engagement with her, and also just directly with certainly Acting Commissioner Morgan. I've personally met with on a couple of occasions, and we have routine and ongoing conversation with the leadership and other folks that comprise the leadership at CBP. So we've had a considerable amount of interaction with them.
Thank you, Mr. Reardon. I understand that The federal law enforcement training centers, FLETC, put a significant amount of time and effort into developing its plans to resume operations. These plans require students to arrive on campus 14 days before resuming in-person trainings. FLETC also plans to test students at least twice for COVID-19 during that 14-day period and test staff who engage regularly with students weekly. However, not all staff will be tested, and staff do not stay in on-campus housing, which means they must travel in and out of the training campus daily. Mr. Reardon, do you believe FLETC has done everything it can to mitigate infection risks to its employees and students' health before resuming operations?
Well, I think that they've certainly put together a plan, and I think you articulated certainly my understanding of the plan that they've put in place pretty well. One of the concerns that I do have, however, and you've mentioned it, is you've got staff who are going home, they're going out into the community, and then they're coming back in. And, it seems to me that it would probably be it would be appropriate to ensure that they are being tested as well. And I think, furthermore, it's important that there is a robust testing and contact tracing program put in place at FLETC as well.
Thank you, Mr. Reardon. Mr. Judd, in the remaining 40 seconds, do your agents have enough PPE for themselves and the people they interact with to keep themselves safe right now?
That's one of the things that I'm very grateful that DHS did well ahead of time. They gave us plenty of PPE. We've been able to protect ourselves as well as those individuals that we come in contact with. If this is what has been done department-wide, I think that we're in a very good place.
Thank you, Mr. Judd. I yield the remainder of my time and now recognize the ranking member of the subcommittee. Oh, I apologize. Yes, and now recognize the ranking member of the subcommittee, the gentleman from Texas, Mr. Crenshaw, for questions.
Thank you, Madam Chairwoman. And I do need to say, I hope in the future, if we're going to do an oversight of DHS and see how they're going to get back to work, we need to have someone from DHS present, and I need to be on record saying that. It should not be up to the minority with our one witness to make sure that there's somebody from the department to come to the hearing. The other thing I need to say, and it's in response to the chairman's very partisan comments about the president trying to ignore doctors' advice every single day as he doesn't wear a mask. He knows very well that the president gets tested sometimes multiple times a day, and therefore there's no need to wear a mask. If we're going to talk about science-based getting back to work, then we actually have to use some science. And we actually have to ask some doctors. Doctors have told us over and over again, the reason you wear a mask is to prevent you from sneezing or coughing on somebody else and possibly getting them infected. It doesn't prevent you from getting infected. We have to remember these very basic things. We've learned a lot in the last few months. We made a lot of mistakes, and we continue to apparently advocate for those mistakes. As the chairman said, we're getting back to work too early, that we opened up too early. That's nonsense. If anything, the data shows that we opened up way too late, way too late. We know this in hindsight. I'm not blaming anybody for this. But this notion that we should continue instilling fear in people is very, very harmful to our society. There's risk in this world, and we're never going to get around to fully mitigating every possible cause of harm. And since the start of stay-at-home orders and social distancing, America's grocers and nurses and other essential workers, they've continued to go to work. They've felt a sense of duty to actually do that. And so I'm going to be asking some questions here about why, and some of these demands are very reasonable, but some of them go well beyond what our private industry and what our grocers have been doing every single day. And I also have to point to some more data which shows that the vast majority of cases that we see come from residential origins. They're not coming from healthcare workers. They're not coming from first responders. This is all from New York. We've had the most cases and we have the most data. And they're not coming from transit workers either. This tells us something. This informs us about how this disease is actually spread. And it's probably not spreading in office spaces where people are separated by cubicles and offices. And so, okay. Dr. Kelly, I want to start with you. There was, again, many of the things you guys are asking for are perfectly reasonable and understandable. but some of it's, I think, unattainable. For instance, a 14 days of exponential decline. Do you mind expanding on exactly what you mean by that? Because that goes a bit beyond what even CDC guidelines are, which I also think are misguided. But please explain how that's possible and how you might compare that demand to a geographic area that has decided to open. Will you not send your federal workers back in an area because you might see a daily spike or something, even though everybody else in that area might be back at work?
Okay. I think, first of all, we should be very concerned about the entire population of the United States of America. Certainly I am personally concerned about the welfare and well-being of the members that I represent. But after universal testing and the identification of the extent of the risk by location, the federal government should apply a punitive, apolitical, science-based standard for the safe return of federal employees to their work site. Now, epidemiologists and other public health experts recommend the standard of 14 days of exponential decline in new cases within a region before erasing quarantines and shelter-at-home restrictions. For federal employees, the region should be defined by community areas.
No, I understand. I understand the guidance. I understand the guidance. I'm asking you to think through it, because here's the thing. In Houston, you could have, a plateau of 100 cases a day, which is basically what we have, between 100 and 200 cases a day. We've never really changed. And so you're saying we can never go back to work here?
No, I'm not saying
4
that.
million people, right? So, I mean, that's what I mean. Like, we have to think through some of these guidelines.
I certainly think that we have to think through the guidelines. However, I think that because there have been so much, inconsistencies across the board, and we have to be consistent as the federal government. That's all that I'm saying. We should be consistent. We should make sure that our entire federal government system is ready to go back to
But
it.
you're implying allowing for some flexibility, right? Just based on that simple thought experiment that I just gave you, because you could have New York City declining by thousands every single day, but they still might have another 5,000 cases a day. You see what I'm saying? Like, so I just want to, I think I think maybe we're agreeing that there must be some flexibility within those guidelines. It looks like I'm already out of time. That went fast. I yield back. Thank you, Madam Chair.
Thank you, Ranking Member. The chair recognizes for 5 minutes the gentleman from Alabama, Mr. Thompson.
Well, I'll be from Mississippi, but I'm
I'm
fine.
so sorry.
Oh, that's all right.
I'm
I've been
so
called
sorry.
a lot worse. Let me be clear. Whatever we do in bringing the workforce back, it should be with the advice and guidance of the medical experts. We can't assume anything else other than what the medical experts say. Our president toured a facility in Maine last week without a mask on. All the work that plant did last week, they had to throw out because he didn't wear a mask. So I'm clear about wearing masks. I'm clear about setting an example. The notion that we now have a colleague who came back to Washington last week and sat on the floor of the House of Representatives without a mask, and his whole family now has COVID-19, puts the entire United States House of Representatives at risk. So with that as a backdrop, I want us to all recognize that this is a serious, serious matter. Wearing a mask is not a sign of weakness. It means that you understand the challenges that you are confronted with. And so I look forward to us making sure that as we bring the workforce back, we do it in a manner that we consult with the medical expert and get the proper guidance, so we don't put those individuals at risk or the people they come into contact with. And I compliment the chairwoman for having this kind of discussion. So, Mr. Reardon, Do you see a need for more engagement at the DHS headquarter level around how do we bring people back and clear guidance, or are you satisfied with the engagements that's going on now?
Well, Mr. Chairman, I will say that I am somebody who always believes that more engagement rather than less is good. I think there are opportunities in terms of guidance that goes out. Um, for example, I think the guidance that exists around how long you need to be face to face with somebody, before that later on has been determined to have COVID-19, is I think it's important to figure out, how we deal with that. Right now, the guidance says, well, it's anything from you talk to the person for 10 minutes to 30 minutes. And I know after a lot of conversations that I've had with a lot of my chapter leaders around the country, they don't have a real good understanding of, so what is the guidance really saying? What does it mean? And so I think that anything that can be done to increase the amount of communication, I think it's one thing to put out guidance, and I think CBP and ultimately DHS has done a decent job of putting out some guidance, but I think there needs to be some follow up so that people understand exactly what does that guidance mean and how do I use that in certain situations. Can't deal with every situation. I get that.
So are you saying that sometimes the guidance is not clear to the people you're sharing it with?
I think my sense is that at times the guidance isn't completely clear, and folks don't know exactly how to implement the guidance. And so I think more conversation around that, more communication is helpful.
So, Dr. Kelly, what has been your experience with the guidance coming either from DHS or TSA or any of your other members?
To say this, that we have participated in some weekly meetings, but we do believe that more engagement and consideration of workers' input is very much needed in this particular situation. Guidance has been, many times we're unsure what the guidance is saying, just like Brother Reardon is saying. But if there would be more engagement, I think we can get a better sense of exactly what the guidance is saying.
Thank you. I yield back, Madam Chair.
Thank you, Mr. Chair. I deeply appreciate your understanding. The chair recognizes for 5 minutes the gentlewoman from Nevada, Ms. Titus.
Well, thank you very much, Madam Chairman. Thank you for holding this committee. I'd like to just ask Dr. Kelly some questions. Lou Correa, who's chairman of the subcommittee on transportation and maritime security of this committee. And I wrote to the TSA administrator about health care for part-time TSA workers. And we had the chairman's support in this, and I thank him very much for that, Mr. Thompson. We then introduced a bill that's HR 6647, Health Care Opportunities for Transportation Security Administrative Employees. We believe that if you're on the front lines, even if you are part-time during these dangerous days where you're really getting exposed, that you should be entitled to health care. We see it here in Las Vegas that air travel is picking up. More people are going through our airports. Our TSOs are more in danger of being exposed. Could you address what some of the challenges are that they're facing and give us your opinion about part-time employees receiving that kind of coverage like everybody else?
You and Chairman for, let me see if I'm on here. Yeah, I appreciate you and the chairman on your efforts to make sure that these employees have the necessary protection that they need. It leads so many times the employees with a lot of stressful situations. They are constantly concerned about their welfare, their well-being, whether or not they would carry some illness home to their family. Because in their mind and in my mind as well, it doesn't matter if you work 20 hours a week, you're still exposed for those 20 hours, or if you work 40 hours a week. So the exposure is still there. And so we are hoping that we can get further down the road with this particular initiative.
Well, thank you. I hope so too, because you're right, they're exposed when they're there. I'd also ask you, we're hearing more about, as we reopen, how we're going to do it in airports. We're going to take people's temperature. What happens to somebody who's found to have a fever? Where do they go? Who's responsible? The airlines, of course, don't want that responsibility. The airports don't especially want it, and they're starting to want to push it onto TSOs, but their job is more security than it is healthcare. Could you talk about that as well?
Well, once again, I do applaud the work that the TSOs do every single day. They're very patriotic employees, and we've seen that over and over again, but they are not medical professionals. And I think that this is a task that needs to be assigned to a medical care professional and not a TSO officer. They do an outstanding job at, making sure that the public fly safely. But I don't know how well they would fare if they had to become a medical professional.
Thank you. Those are my main questions. I'll yield back, Madam Chair.
Thank you, Congresswoman Titus. The chair recognizes for 5 minutes the gentlewoman from New Jersey, Ms. Watson Coleman.
Thank you very much, Chairwoman. I appreciate this hearing, and thank you to each of the witnesses for the information that you shared. I first want to respond to the ranking member's concerns about not having administration representatives at the committee meetings. We have consistently invited members of this administration, the DHS administration, and other offices to come before us, and they've declined to do so. So it isn't that we don't want to hear from them, because we most assuredly want to hear from them. Ultimately, they're the ones that are going to be held responsible, and we want to make sure that we're doing all the work that we need to do to ensure that when we do reopen, we reopen safely, that the people we serve are safe, that the people who are doing the work are safe, and that we know what to do should there become a re-shutdown. And so I just want to put that on the record so that the record represents more than just sort of one perspective on what's happening in the world. I have a question. There was a question that was raised to Mr. Judd, Mr. Kelly, and Mr. Reardon regarding their interaction with the Department of Homeland Security. And Mr. Judd responded, good interaction, strong. Mr. Reardon said high level with CBP and DHS, routine interaction with DHS leadership. Mr. Kelly said not very successful in working with DHS. So I want to drill down a little bit. I want to know a couple of things, and if they can just rip them off really quickly, I'd be fine. So Mr. Judd, Mr. Kelly, and Mr. Reardon, tell me the components, the offices that you deal with, and then tell me the individuals that you've been seeking or having interaction with. And Mr. Kelly in particular, I want to know from you, where have you not gotten the kind of feedback, and from whom, that you thought you needed in order to have this discussion about how we move forward safely? Those are my questions, Madam Chair. And they're for everyone, so we can start with Mr. Judd, and then we can go to Mr. Reardon, and we can end with Mr. Kelly.
Thank you. I'll be glad to answer. I have communications with the top level in Border Patrol. That's directly with Chief Scott. I then have communication with the top level in CBP, which is Acting Commissioner Morgan. And if need be, I can go to DHS and speak with the DHS Chief of Staff, John Gutanis. But I haven't needed to go there, haven't needed to exercise that privilege. I've been able to work through the issues with Chief Scott and Acting Commissioner Morgan.
Thank you.
This is Tony Reardon. I'll jump in there. And at DHS, as I think I mentioned earlier, I have a weekly call with Angie Bailey, the Chico at DHS. With regard to I couldn't hear. You're on mute.
Sorry. Whoa, here we go.
Still muted. I can't hear you. Chief Human Capital Officer. Sorry.
That your employees work under?
Yes, the Office of Field Operations within CBP. And we also represent some employees at the Federal Law Enforcement Training Center. So Angie Bailey, I deal with, as I said, weekly. I also have had quite a few interactions with Acting Commissioner Morgan, as well as Deputy Commissioner Robert Perez. And we have, I don't know if I would say daily, but we have very frequent interactions with Executive Assistant Commissioner Todd Owen at CBP in the Office of Field Operations. And then, of course, we have chapter leadership locally around the country, and they deal with local management and the DFOs there around the country. So we have, quite a bit.
Thank you. Mr. Kelly?
Okay, can you hear me now? Okay. Well, first of all, as I've mentioned, we've participated in some weekly calls, but we'd like to have more communication between agency leadership and the workers. We should have more communication between agency leadership and like the TSO councils, TSA councils, or the FEMA council, or, we're just not getting that level of communication. And I think we need that if we're going to be successful.
Thank you, Ms. Watson-Coleman. I apologize, but your time has expired. And so I appreciate the questions. And now the chair recognizes for 5 minutes the gentlewoman from California, Ms. Barragan.
Thank you, Chairwoman Torres Small, for convening this hearing. As the states and the local governments begin to reopen and people start to physically return to work, we must keep in mind that the pandemic is not over. The coronavirus is still impacting all aspects of life daily. Cases are still on the rise, and health experts predict a second wave of infections. You don't have to look any further than to look and hear Dr. Fauci and his concerns that he's expressed and the medical data that he's relying upon. I want to say that in California alone, we've seen infections top 151,000 and nearly 5,100 people just in Los Angeles County have died. That accounts for lots of lives that are being impacted. And so I think it's critically important that we're having this conversation on workers and asking what can be done to make sure that when we try to go back to some sense of normalcy, that we do so safely. Mr. Judd, I'd like to start a question to you. In your statement, you advocated for Border Patrol to get thermal scanners in an effort to screen the health of migrants at the border. However, makers of these scanners have cautioned that they are not intended for medical use and can only scan for elevated skin temperature, which can be caused by a variety of other factors. For example, physical exertion while outside in warm climate like the southern border. Mr. Judd, what information has led you to believe that this would be an effective screening measure for the Border Patrol? I think you're on mute, sir.
Wait, can you hear me now?
I can hear you now. Thank you.
Okay. Well, one, my personal doctor. I've been to the doctor several times during the pandemic, and they've told me that these scanners work very well. We've also done our own personal research. Again, I'm not saying that it's the be-all, end-all, but it is one of those indicators that we need to look at. We need to be available to identify when somebody is showing certain symptoms of the pandemic of COVID-19 to ensure that it's not spread throughout the United States. So we need to look at all of the different things that we can possibly use. And that's just one tool that would help us look for indicators.
Okay, well, thank you. I guess my caution is if the makers of the devices themselves are warning they're not for medical use, would that be the best use of our resources? But thank you for your insight on that. Mr. Judd, one more question for you. We've certainly seen the reports about the use of CBP agents and ICE agents at protests nationally, certainly in Washington, D.C. What are CBP agents doing at these protests? Can you shed some light? It certainly instills fear amongst immigrants who want to exercise their First Amendment rights, and the militarized exercise, scares citizens too. I believe the DHS has confirmed that CBP will be active in Arizona and California. Can you give me some insight on what CBP officers are doing there?
Yeah, first and foremost, we don't make that decision on our own. We're not the ones who decide whether or not we're going to go in and help. What we do is when we receive requests for assistance from other law enforcement agencies, then we go in and we assist them under their authority, not under any authority, under any immigration authority. So we're not there to arrest anybody for immigration violations. We're not the military, so we're not militarizing anything. We are law enforcement, so we're assisting our local law enforcement partners when they ask for assistance.
Okay, thank you, sir. Mr. Kelly, Dr. Kelly, apologize for that. U.S. Citizenship and Immigration Services, which is funded by fees paid by applicants, recently announced it expects to run out of funding by the end of this summer. The agency noted a drop-off in applications during the pandemic, which likely exacerbated issues caused by the administration's policy aimed at curbing legal immigration over the past several years. Dr. Kelly, how do you think this budget shortfall will affect the component's ability to adequately provide staff with PPE and modify facilities to adhere to social distancing guidelines?
I think that it vastly affects the ability to provide that particular care for those employees and immigrants. I think that we have to make sure that they're funded adequately so that we can ensure that the protection is there.
Great, thank you, sir. I yield back.
Thank you. And I thank the witnesses for their valuable testimony and the members for their questions. I also thank everyone for their patience as we worked through the bugs that we've seen in the midst of all of this. And again, reiterate my gratitude for everyone's willingness to do this online forum and hearing. I also want to thank the committee staff, both the majority and the minority, for working on this issue. And we will continue to work to find ways to make sure that relevant witnesses are able to attend these formats. And I look forward to working on that with the minority as well. The members of the subcommittee may have additional questions for the witnesses, and we ask that you respond expeditiously in writing to those questions. Without objection, the committee record shall be kept open for 10 days. Hearing no further business, the subcommittee stands adjourned.